Welcome to another episode of the Cruz Orthodontics podcast. Today, Dr. Cruz is going to tell us everything parents should know about children's orthodontics. Dr. Cruz, what age should parents consider orthodontic treatment for their kids?
Yeah, that's a good question. I think my response to that would be it's less about age and more about dental development. So you can have kids, oftentimes girls, that will have all of their adult teeth by the time they're 10 years old. And sometimes with boys, you can have adult teeth come in and as late as 15, 16
Mm.
years old. So oftentimes when trying to decide whether or not early treatment for a child is justified, I'm looking more at dental development. And so, as a general rule of thumb, I'm looking at whether the upper and lower front teeth have erupted. And so, to put an age on that, usually it's around 7 or 8 years old, but sometimes it can be as late as 9 or 10 years old. Once those adult, what we call incisors, have erupted, then I can get a pretty good gauge as to whether or not it makes sense to consider doing early treatment.
So, what are some common signs that shows a child might need some orthodontic treatment?
Yeah, that's another good question. I guess I'll start by saying that sometimes I feel like early treatment, or what we call phase one treatment for young children, is overprescribed and not necessarily needed. My philosophy tends to be that if we can wait for all of the adult teeth to erupt and treat a patient orthodontically one time, that typically is my preference. And so, generally speaking, the things that you're looking at to decide whether early treatment is justified, I think you can sort of boil it down to two things. One is, do they have what I would describe as severe crowding? There's simply not enough room for all of the adult teeth to erupt. Or do they have something that we call a crossbite? And so, crossbite means that some of the upper teeth are actually trapped on the inside of the lower teeth. And so sometimes that crossbite can be an underbite, which happens in the front, or sometimes that crossbite can be with the back molars. So if there's either a crossbite or severe crowding, those are usually the two things that we think about doing in early phase of treatment to resolve.
So, what are the most common orthodontic treatments for children?
The big one is expanders, and so you'll hear a lot of parents or children refer to them as spacers. We call them expanders. And generally, those expanders are used on the upper arch. And so we use them to widen the upper arch or upper jaw to create space for those crowded out adult teeth or to help fix cross bites. And so, oftentimes that can really set up a young child later in life to have, a much healthier bite.
So, how do you determine if a child should wear metal braces or aligners?
I think first and foremost, what we always look at is trying to consider whether or not compliance is going to be good if we're thinking about doing clear aligners. Oftentimes we'll ask kids if they're wearing glasses or contacts, how responsible they are in not losing their glasses or wearing their contact. We'll ask them questions to just sort of get a feel as to whether or not they're going to be responsible and do a good job with wearing the aligners. And then the second thing that we look at are the bite. There are some types of bites that braces are just simply better at fixing. Deep bites, for example, is something that braces do a wonderful job of fixing. And then open bites, the opposite of a deep bite, can be really great to fix or resolve with aligners. So that's the other thing that we'll oftentimes look at.
Well, so how long does orthodontic treatment usually take for children?
More often than not, a year and a half is sort of our bread and butter answer. That can be plus or minus a few months, but typically with what we're doing at a young age, a year and a half is enough time to fix it.
So, what can parents expect during their child's first orthodontic treatment?
Few things to sort of expect, although those things are improving. So the first one is, and oftentimes children and parents are concerned about how sore they're going to be. And so there's definitely some soreness those first few days of treatment. I know, Rich, you and I have talked about this new device that we now use called the Synapse that's wonderful at alleviating pain without having to take drugs like Tylenol or Advil. So soreness is one of those things that usually is experienced, and it's generally pretty mild now. Some of the other reasons why it's mild, in addition to being able to use the synapse, is that the expanders are much more comfortable and less bulky than they used to be. And then the second thing that can be expected, especially if an expander is going to be used, is we tell the kids and we tell the parents that there may be a lisp for the first few days. Normally, the tongue starts to sort of accommodate and acclimate, and so that lisp is very temporary. But we always like to let them know in advance, just so that they're not surprised that may happen.
So, how often will the child need to visit the office during a typical treatment?
Generally speaking, it's every 2 to 3 months on average.
So, over a year and a half period, was that 6 to 8, maybe 10 times?
Yeah, I think that's reasonable. Normally, on the front end of treatment, those appointments might be a little bit closer together, maybe every 4 or 5 weeks for the first couple of appointments. The middle part of treatment tends to be every 2 to 3 months. And then when we get towards the end, where we're doing some detailing and making sure we get everything refined and looking good, the appointments might be every 5 weeks, something like that.
So, are there any risk or complications with children's orthodontic treatment?
Yeah, that's a great question. I mean, I think that anything that involves medical or dental treatment can have some inherent risks. And granted, with orthodontics specifically, those risks are exceedingly rare. One of them is what we call root resorption, or sometimes in layman terms, I'll sort of describe the roots of the teeth as melting. That's not something that we want to have happen. Obviously, we want the roots of the adult teeth to be long, and we want them to be able to hold these teeth firmly into the bone. And so, a couple of things can happen. One is if you move teeth too aggressively, you can get this root resorption to occur. Or on occasion, what can happen is even if you're sort of kind and gentle in how you're moving the teeth, you're taking your time, you can get what's called idiopathic root resorption, where for no apparent reason that we're aware of, it can happen. Oftentimes, what we do to make sure that if it happens, we're catching it really early is we'll take x-rays, usually every 4 to 6 months, just to be able to make sure that everything is nice and healthy. The other thing that can happen, although it's also extremely rare, is there can be allergic reactions. Some of the materials that we use in orthodontics may have a little bit of nickel in them. Nickel is a common sort of allergen that can cause irritation to the skin or the tongue. And so it really doesn't happen often. And normally it's very easy to spot. And it's also very benign when it happens. Usually you'll show a little bit of a rash, and we can sort of make an adjustment to treatment and use a different material. I think the one thing I'll say that's probably more important to discuss is not what the inherent risks are of doing orthodontic treatment, but what the risks are of not doing orthodontic treatment. So what I see happen much more frequently is we'll have patients, prospective patients come in. I'll explain to them why I'd recommend doing treatment. And for whatever reason, they decide that treatment is not for them. And then they'll come back a couple of years later, and now we have some really serious issues, root resorption being one of them, for example. So if you don't create space for these adult teeth and they're so jumbled up and so tight that as they're coming in, they're firmly bumping into each other, you can start to potentially lose adult teeth that way. So I guess my point is that the risks, in my opinion, of not doing early treatment when it's justified can be greater than actually doing the treatment.
Makes sense. So, are there any ways that parents can help support their children during orthodontic treatment?
Yeah, absolutely. It's oftentimes when we're doing early orthodontic treatment, you've got to think that these kids are 7, 8, 9 years old. So it's kind of the common sense things to support your kids. One is helping them to brush and floss, especially in the early part of treatment. Having an appliance in their mouth, whether it's an expander or braces, can be a little bit more work to be able to keep it clean. So oftentimes parents will help out. The other thing that you can do is, oftentimes parents will help with regards to being able to turn the expander. Sometimes these expanders are actually fixed onto the teeth, and so it's not possible for a youngster to be able to use the little key to be able to do the turn. So we need parents' help with that. And then the last one is be positive. I think that oftentimes when we have moms and dads that are really upbeat and positive, that positivity and excitement can be contagious, and that it also has the kid becoming excited and has them end up being more sort of compliant, which works out well.
Are there any common misconceptions about children's orthodontics?
One of the common misconceptions is that every child needs it. And unfortunately, some offices, in my opinion, are a bit aggressive with regards to who they are recommending early orthodontic treatment for. In fact, it's sort of this mentality that anybody that walks through the door needs
Mm,
early orthodontic treatment. And it's simply not true. I know we mentioned it a minute ago about, you know, if you have severe crowding or cross bites, absolutely, that's a situation where it makes sense. But oftentimes, at least in our office, what we're trying to do is make that decision as to what is in the best interest of the patient. And if I can, what I try to do is let all of the adult teeth erupt and come in and then treat that patient one time as opposed to doing an early phase of treatment, taking a break, and then having to do a second phase of treatment later down the road. So I think there's this misconception that every young child needs early orthodontic treatment. In fact, I'll have parents come into the office and say, gosh, when I went to pick up my kid from school, I noticed that all of their classmates, all of his classmates or all of her classmates had expanders in or had braces on. And so they felt like they were
mm.
missing the boat. And so I think that, unfortunately, I think that's one of the things that happens.
So, are there any long-term benefits for children undergoing orthodontic treatment?
Huge benefits. So some of the bigger benefits are if you do early orthodontic treatment and you make space for these adult teeth, you can avoid having to have adult teeth
Mm,
extracted later in life. I'm starting to get up in age a bit. And so what used to be really common when I was a child is that if there wasn't enough room for adult teeth, you'd simply have two adult teeth on the top and two adult teeth on the bottom removed. That would then solve the crowding issue, and then you'd straighten the
mm.
teeth from there. What we started to figure out was by doing that, it actually causes a sort of a negative impact with regards to the profile. And so we started to notice that lip position started to flatten, which isn't something that people tend to want. You don't
Yeah.
want thin, flat lips. And so even though the teeth looked good, the teeth were straight, there were other problems in having these perfectly good teeth removed. So avoiding extractions is a big one. On sort of the more extreme end, if for those patients that have significant cross bites, if you're able to do an early phase of treatment for them, you can avoid them having to have jaw surgery later down the road. And I certainly don't use that as a threat or a scare tactic to convince parents to do early phases of orthodontic treatment, but it's certainly justified when kids have significant cross bites. And then, some of the more obvious reasons of doing early orthodontic treatment is you'll see self confidence boost. I mean, for these youngsters that have severe crowding, in 6 to 9 months, we can really have a positive impact with regards to how straight the teeth are, and you can genuinely see their confidence kind of boosting up as we do that. So that's always rewarding for us.
So, how has technology advanced children's orthodontic treatment?
Yeah, that's a good question. I know you and I, Rich, have talked about some of the kind of latest and
Hmm.
greatest things going on. Dental monitoring has been amazing. The ability for me to have our patients use their phones, scan their teeth once a week so that I can keep much closer tabs on how our patients are doing and sort of right the ship if we notice that anything with regards to treatment isn't exactly on point, as opposed to the old way of doing things, which used to be, waiting every couple of months to see how our patients are doing. So that's been a big advancement. The synapse that we talked about to help relieve pain has been big. And then, there's some really cool things with regards to how the expanders are made now. So now scanning patients' teeth as opposed to having to take impressions so that we can have these 3D models printed. And now they actually are making 3D printed expanders that are genuinely custom made for the patient, which means they can be smaller and they can be more comfortable. So yeah, there's some pretty cool things that are going on within the world of orthodontics.
So, what advice would you give parents who are considering getting their child treatment?
That's a great question, and it's a little bit of a point of contention for me. What I would encourage is just make sure that whoever you're seeing was trained at an AAO, American Association of Orthodontics, accredited university. Um, Oftentimes, there will be clinicians who are not orthodontists that do
Mm.
orthodontic treatment, and that's all good and fine. I just want to make sure that those patients are being treated by people that were really trained to do an excellent job of taking care of their children.
So, how do you find one of these qualified orthodontists? Was there a website?
That's Yep, I think that's probably the easiest way to do it. It's pretty easy to validate it now through the internet to just make sure that they were actually trained at an AAO accredited university. And so oftentimes you can go to their website, and every website will have a bio of that
Mhm.
orthodontist or that clinician. And so you can then see exactly where they were trained at.
Can you talk about insurance coverage and different options parents have?
Yeah, sure. I mean, it's hard to give a specific answer with regards to that, but generally speaking, if somebody has orthodontic insurance, oftentimes that ortho insurance will cover anywhere from sort of a quarter to up to a half of the orthodontic fee. And then oftentimes, not just at our office, but at a lot of orthodontic offices, there's the ability to do kind of interest-free
Mm.
financing for the remaining balance. I mean, the last thing we want is for finances to be an obstacle in providing treatment for your children. And so then we can kind of structure it from there to where you've got monthly payments that are affordable. Generally that's how it works.
Is there anything else you'd like to share about children's orthodontic treatment?
The only thing that I would sort of add to all of this is that even if you don't think that your child needs early orthodontic treatment, and I can fully appreciate that, the nice thing about getting an initial consultation at 7 or 8 or 9 years old is, we take a digital panoramic x-ray, very low radiation, and you can pick up a lot of things that are potentially going to be happening years later. So for example, you can pick up whether a patient has extra teeth that
Mm.
you didn't know about, what we call supernumerary teeth, or you can pick up whether or not they have missing teeth, and so you want to start accounting for that and planning for that. So I guess what I'll say is oftentimes families, and I completely understand why, is you'll look at your child's teeth and you'll think, hey, everything looks good. I don't have any concerns. But oftentimes it can be really beneficial to just look and see what's going to be happening over the next few years as the adult teeth are
Great.
developing.
Well, Dr. Cruz, thanks for coming back, and looking forward to hearing from you again.
Yeah, my pleasure.